Well, the clinical definition, as defined by the Center for Disease Control, is that mental illness is it's the dysregulation of moods, thoughts, and/or behaviors that are outlined in the DSM, the Diagnostic and Statistical Manual for Psychology. Well, first, obviously, the person with the illness would have to recognize that there's something wrong, and they'd have to want to seek treatment. And then when they come in, you essentially just have a conversation with them. And the DSM, the Diagnostic and Statistical Manual, it gives you criteria for every type of disorder there is under the sun. So you would come in, you would just sit down, talk to the patient or the client, and have a conversation with them about what they feel is going on, what they think could be wrong, and then you go from there. Well, the thing about mental illness is that it doesn't discriminate based on race, gender, creed, religions, or socioeconomic status. So it affects everyone. Like everyone in the country is either directly or indirectly has been affected by mental illness at some point. Well, treatment that's more of a socioeconomic issue. Like people who have the available disposable funds and resources to go see a doctor, a psychiatrist, a psychologist, or anything like that, seeks treatment. So I would say middle class to upper middle class. Like poor people can't afford, they don't have the disposable income to go and to see a doctor and say, I'm depressed, because a lot of times doctors, their fees can be in the hundreds of dollars per hour. And that's for not even like the highest, most qualified doctors. Depression, it's a mood disorder. It's defined as like one of the major characteristics is a pervasive feeling of sadness or hopelessness. A lot of times you can't get out of bed in the morning, and it's like you can't control it. It's not like, oh, you can't just think, I want to be happy, so I'm happy. So a lot of times it's a chemical imbalance or genetic factors that come along with that. It can be anywhere from 4 to 6 weeks. Usually about 3 to 4 weeks is the baseline, where a doctor will say, okay, you've been feeling this for a while. And then like after 6 weeks, if you've been feeling that way for 6 weeks straight, you're more than likely to get diagnosed with some type of mood disorder. Well, the first thing you should do if you think someone has a mental illness is don't be confrontational about it. The last thing you want to do is put someone on the defensive about themselves. So if you think someone has a mental illness, like maybe talk to them about it. Like, hey, are you feeling okay? Do you think something's wrong? And you can't force someone to go get treatment. Unless they're in immediate danger to themselves or someone else, then there's not much you can do. You can't force someone to go look for treatment. So just encourage them to maybe seek help. And the last thing you want to do, like I said, is just don't make them defensive. You don't want them to feel like there's something wrong with them. Even though there may be something wrong with them, the last thing you want to do is make them feel stigmatized because of it.
Thank you for watching A Wise Way. Subscribe to stay updated, share to pass the knowledge, or view our other videos on the left.